Home care workers and people receiving support can be affected by unsafe working practices and by unsafe environments. The aim of health and safety is to ensure that the people you support, you and any other people affected by home care, will stay healthy and safe. Other people can include relatives, children, friends, and other healthcare professionals. This video sets out to make you more aware of the many potential hazards in the homes you may be working in, and highlights some key practical steps to follow to help reduce accidents and ill health within home care. Every care worker has a legal duty for health and safety, and if they fail to follow their company's policies and the law, they could be found legally responsible for any accidents or dangerous incidents that may occur. The next section will explain your main responsibilities for health and safety. The Health and Safety Executive have defined health and safety as the measures necessary to control and reduce risks to the health and/or safety of anyone who might be affected by the activities of people at work. There are several laws that relate to your home care office and your activities within the home. The key laws are the Health and Safety at Work Act. This Act is supported by the following regulations: the Management of Health and Safety at Work Regulations, the Workplace Health, Safety and Welfare Regulations, the Reporting of Injuries, Diseases and Dangerous Occurrences Regulations, RIDOR, the Regulatory Reform Fire Safety Order, the Personal Protective Equipment at Work Regulations, the Provision and Use of Work Equipment Regulations, the Manual Handling Operations Regulations, the Health and Safety First Aid Regulations, the Control of Substances Hazardous to Health Regulations, COSH. As a care worker, your main health and safety responsibilities are taking reasonable care for your own health and safety and that of others who may be affected by what you do or do not do, cooperating with your line manager on health and safety, correctly using work items provided, including personal protective equipment such as gloves, in accordance with training and instructions, and not interfering with or misusing anything provided for your health and safety or welfare. The law requires employers to identify hazards and associated risks in your workplace, to take sensible measures, and in most cases use the principle as far as is reasonably practicable to tackle them. This term is described as balancing the level of risk between time, effort, and cost. The Management of Health and Safety at Work regulations specify that the employee must report hazards that are not adequately controlled to their employer. Hazards can occur outside of the home, inside the home, for example, poor housekeeping, whilst carrying out an activity, for example, shopping and using chemicals, and also relate to your behaviour, for example, being distracted, and to the person you are supporting's physical or mental health, for example, verbal aggression. You must have access to the policies and procedures that your particular agency or organisation has laid down with regard to health and safety. You must understand your obligations, safe systems of working and responsibilities, then put them into practice. As well as your legal responsibilities, knowing how to act and being alert and vigilant at all times can prevent injury, accidents, infections, and even death.